Welcome back. Thank you very much for staying with us. Now, South Africa's health sector is constantly under strain. In the Eastern Cape, healthcare has been raking up medico-legal claims at an alarming rate. There have already been 138 medical negligence claims this year alone. It's costing the department millions of rands. The president is now expected to discuss health in his State of the Nation address tomorrow. eNCA senior reporter Ronald Masinda is speaking to families who say they've been victims of negligence, and he joins us now with the very latest. Ronald, good morning. You know, negligence cases are a serious cause for concern because hospitals is where many expect to receive help for their health problems, not for them to add health problems. What is the department actually saying?
Yes, we'll find out from the department, but what the department has said is that they are currently facing around 138 medical legal claims. Now, this is a vast improvement if one compares to 2017-2018 financial year, where they faced around 564 cases. The most recent case, a judgment was passed yesterday in Bisho, where it was found that the department was sued for over 35.4 million rand. I mean, this is a case that took place here at the Cecilia Makiwane Hospital, where it was found that a child who was just born had a cerebral palsy condition. For more on what has been taking place in the health sector, I'm joined by the MEC for Health spokesperson, Khululi Namasa. Thank you so much, Khululi, for your time. Just give us a sense or an idea of what this actual case, the one where judgment was passed yesterday.
Good morning, Ronald, and good morning to your viewers, and thank you for inviting us. Indeed, there was a judgment by the Bisho High Court yesterday, whereby it was ruled that the department does not have to pay lump sum payments, which was previously the case in previous years. This is a case that dates back to 11 years ago, whereby a child which was born at this very same facility at Cecilia Makiwane Hospital was born with a condition called cerebral palsy. The department did in court acknowledge that indeed we're in the wrong, and we acknowledge that, but we presented a case saying we cannot continue paying lump sum payments because that cripples the service of government. That also means that we cannot continue providing the same quality of services and care to the millions of people in the Eastern Cape that rely on the public sector for their health needs.
How were you wrong, though? I just want to understand that.
It was a case of medical negligence, which was as a result of many other aspects that we might not get into at the moment. But the child was born during labor. There were complications which resulted in the condition cerebral palsy.
Your department released a statement, and a lot of people are quite shocked at the wording. It was almost as if you guys were celebrating this judgment in terms of not paying the lump sum payments. At the end of the day, that money has to be paid.
At the end of the day, the department, according to the judgment, has to provide future medical care to the child, which is what the judge did order the department to do. This is something that will continue to do over the lifespan of the child. And indeed, we must say that the judgment is definitely much needed reprieve for the department, because the department has been paying millions and millions of rands in medical legal claims. So we would definitely welcome this judgment, because it will definitely assist the department in ensuring that we do continue providing quality health and care services to the people of the Eastern Cape.
The department has been paying millions of rands, money of which could have been used to assist the healthcare sector here in the province. For some reason, I get the idea that there are lawyers who are benefiting a great deal from this.
Indeed, Ronald, you're correct in your analysis, because that is exactly what's happening. Because we must say that it's not all lawyers, because we cannot say all of them are doing these unscrupulous things, because some of them are unscrupulous and they end up taking the lion's share of the department of the payments that have been made to the claimants. So we welcome this judgment, because it's really going to assist the department, and we must say that this, we hope it will also serve as a deterrent to other would-be unscrupulous lawyers who have been seeing the department as a sort of a cash cow and targeting. You'd remember that before these medical legal claims, which is not only in the Eastern Cape but South Africa and the world over, there were some lawyers who were targeting the road accident fund. That tab has since been closed. That is what the department is doing now to ensure that the money, that taxpayers' money, is used to service the people people, not to go into certain individual lawyers' pockets.
A whopping 138 medical legal claims, that is nothing to be proud about. But it has also to be said, what are you doing to deal with these issues such as negligence, which clearly it is plaguing the healthcare sector?
Definitely, it's nothing to celebrate or to be happy about, but we are committed to ensuring that we continue making sure that we fight this scourge and ensuring that we decrease the number of medical legal claims. One of the interventions we're making is ensuring that we employ qualified medical specialists and healthcare workers. For example, this current financial year, the department set aside 710 million rand to employ 2,941 employees, majority of those being clinical employees. The department also has an integrated medical legal claim strategy in place, which also involves working with the Office of the Premier and the Provincial Treasury, with the Office of the Premier taking lead when it comes to the defence in cases in courts, while the Provincial Treasury is also investigating suspected case of fraud when it comes to people claiming whereby there was no negligence when it comes to the department.
Just a last point on that. Does the department annually sort of budget for these court cases?
Not at the moment or in previous financial years, because that is not something we've been planning on to say this is how much we were planning on being negligent. But there is a view that maybe we should consider budgeting for those medical legal claims to ensure that the department does not continue robbing Peter to pay Paul, and ensuring that we take from here to there, so that we ensure we pay the medical legal claims. So that is an ongoing engagement within the department.
No, you certainly can't budget for negligence. That is just simply not on. But my last question, we know that there's been a lot of overnight rain, especially in areas like Bomani. What is the current situation? We are led to believe that people have been evacuated.
At the moment, when it comes to our facility in Komani, the Frontier Hospital, it's been affected because there's no power that supplies the hospital, so we are basically using backup generators, and we're also working with private ambulances and the private Life Queenstown Hospital to ensure that people who are in need of serious medical assistance, they do get the service, so that people's lives are saved, and ensure that we continue servicing the people of Komani and the greater Kisani. But we must say that our teams have been hard at work working with the private sector to ensure that lives are saved, and where the need arises, we will take patients and transfer to different facilities. And in cases whereby a patient was going to be transferred to Frontier Hospital, we will be using other facilities like eNCA and other facilities to ensure that we continue servicing the people of the Eastern Cape.
All right, Mr. Ndamase, thank you very much for your time. And the next hour, we'll be trying to speak to some of the complainants, people who will be filing some legal issues against the department.